Hello, I'm Dr. Henry Rosenberg, the President of the Malignant Hypothermia Association of the United States. Today, I'd like to speak to you a bit about our signature program, MH Hotline. I'd like to tell you a little bit about the origins of the hotline and how it functions. A slideshow accompanies this video blog for you to look into a little further. So in 1981, the MHAUS Association was created by a group of patients who had not always pleasant experiences with malignant hypothermia, either themselves or a family member. They came together because they realized that many professionals and certainly many patients had no idea of the nature of the malignant hypothermia syndrome. I was asked to be the medical advisor for the group, which I happily accepted. What we found out after going to various meetings and speaking to a lot of clinicians is that the information and knowledge about malignant hypothermia was not always adequate, not always understood, and not always applied. And the fact is that there were several deaths from malignant hypothermia every year. So there clearly was a need established for education on this syndrome. It was clear by 1979, 1980 that the treatment drug dantrolene, which was approved by the FDA in 1979, was efficacious in the treatment. The association, which was created in 1981, set about providing educational information at meetings and by mailings. There was no websites at that time, to practitioners and anyone else who was interested. But we began to realize that as much as we could provide information, it was often necessary to provide on-the-spot guidance to clinicians who are dealing with questions of malignant hypothermia. So the concept of a hotline was developed and promoted primarily by the then President, Sue Ellen Gallimore. The idea of a hotline would be that any clinician could call one of our experts and get ongoing advice in how to manage the patient that they are dealing with. The problem was how to set up that hotline and how to make it work. After a good deal of investigation and research, we found that the Medical Alert Foundation, which had a long history of providing information to clinicians about patients' conditions where a patient was unable to communicate, would be an ideal vehicle for connecting the clinician with the expert. So when there was a problem that a clinician needed help with, they would call the Medical Alert number, which was listed as the MHAUS hotline number, and then get connected to one of the experts that were on call. Initially, there were about 12 experts in malignant hypothermia that volunteered their services. And there are 3 experts on call at all times, so that we can have 24/7 coverage. The 12 experts handled a number of calls every month, and many of them were interesting. Many of them resulted in successful treatment of patients, and they were also very edifying to the experts and to the Malignant Hypothermia Association. The experts, when they received the call, would record the details of the call, and those would be kept in the MHAUS office, and where possible, personal identification was not included in the information. When it was not possible, the information was held in strictest confidence. The information was not available to anyone except for those who are involved in the Malignant Hypothermia Association, such as our physician professional advisory council or board members. The schedule for the hotline, to make sure that the consultants were available, was coordinated and still is coordinated by a member of the staff. That staff member is Gloria Artist, and she identifies the individuals that are available and schedules the coverage, as well as coordinates collecting information from them. So from a small number of consultants with a small number of calls, the hotline grew to now there are about 600 calls a year, handled by 30 volunteer experts. And we are extremely grateful for those people who are volunteer their time and expertise. Dr. Ron Littman, who is board member of MHAUS, professor of anesthesiology and critical care at the University of Pennsylvania and at Children's Hospital of Philadelphia, is the medical director of the hotline. He reviews the calls and chairs meetings of the hotline consultants, which we have periodically, where we discuss particularly challenging cases or situations. From those meetings, a series of recommendations have been developed. Those recommendations are discussed and then posted for public comment on the MHAUS website. So the slideshow, as I said, will show you some of the nuts and bolts of how the hotline works, some of the successes of the hotline, and how it continues to grow and expand. I should mention that the hotline has been adapted in other countries for similar hotlines. For example, in the United Kingdom, in Germany, Brazil. Those hotlines are not necessarily associated with the MH hotline of the United States. I'd also like to remind you that this hotline, although we do not charge money either to the clinician or to the institution from which they call, because we felt that would not be in the best interest of good patient care, nevertheless, money and resources are required to maintain the hotline. And in fact, the organization is charged a small amount of money for each call that is connected to a hotline consultant. None of the consultants are paid for their services. Generous support from for the hotline comes from a number of different places, including those who are members of MHAUS, various commercial organizations, the American Society of Anesthesiologists, the American Association of Nurse Anesthetists, just to name a few. But nevertheless, for a not-for-profit, it's always a struggle to bring in revenue to support the activities of the organization. So I'd like to thank you for listening. Thank you in advance for the support that you give MHAUS, whether it's for the hotline or for other services. And if you have any comments or suggestions, please feel free to transmit them to the organization. You may write to Gloria Artist at gloria@mhaus.org or Diane@mhaus.org. So thank you again for your attention.